Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also in Hampden and Hampshire counties, and in particular, strongly in the Pioneer Valley with our new office in Chicopee. And in the area of healthcare, things are evolving dramatically, things are changing, and it's important to find more efficient ways to provide care, and one of those ways clearly seems to be in the area of home care and with those clinical services within the home. So I'm very happy to welcome to the program our CEO of Porchlight VNA and Home Care, Holly Chaffee, who is here. Welcome, Holly.
Hi, John.
It's great to have you. Have a drink of water, and Pat Kelleher, who is the Executive Director of the Home Care Alliance, which Porchlight is a part of. So both of you, welcome to the show. It's great to have you.
John.
Thanks, John.
And I can tell you that as healthcare has been evolving and changing, people are wondering what is the most efficient way to do business, what is providing the highest level of care. I think we're finding that at home is definitely one of the more efficient ways of doing things. So this is one of the things we want to talk about today, Holly. So that seems to be the case.
Absolutely. Home care is the most cost-effective way to treat someone post-hospitalization after surgery. We have the full continuum of care. We have a nurse practitioner who can go home and do visits to check on things that are more acute than what a regular visiting nurse could evaluate or treat. We also have the home health aides, which can help them with their personal care, and homemakers can do the housekeeping part of things, and it keeps people safe at home.
And Pat, welcome to the
Thank you, John.
Berkshires. And where are you based?
I'm based in Boston, but we represent home health agencies from the Berkshires all the way to the Cape. So many agencies like Porchlight VNA are members of our association.
So tell me what the Alliance, the purpose and its goals in healthcare.
Well, the Home Care Alliance primarily has sort of three goals and three audiences. Mm-hmm. One of our first goals is to work with our members like Porchlight VNA to continually improve best practices, bring new ways of doing business to them, new clinical skills, so we work with our agencies to improve their practices. We also have a goal of speaking directly to patients and families and citizens across Massachusetts to make sure that they understand the value and the possibilities in home care. There are lots of people who really could benefit from home care that sometimes aren't thinking about it or understanding that they may qualify for it. And then our third audience is our elected officials, both in Massachusetts and in Washington, D.C., to make sure that they are pushing policies that actually help us to do more in the home.
All important constituencies as you look to be an advocate for your goals. But that educational piece I think is very interesting to those families, because as things have shifted, the ability to provide a higher level of clinical care has also shifted. What was once done in a SNF or nursing facility, I believe, can now be done more at home. So I think families perhaps would be surprised as far as the level of care, especially in rehab,
Right.
that the kind of care that people can get at home.
That's right. I'm sure Holly can speak to that at her agency, but that is absolutely true that healthcare is coming home. We've had a lot of reform in our healthcare system federally and on the state level, and without getting into the details of that, one of those reforms is to make sure that healthcare is delivered in the right place, the right setting, with the right caregivers. And we in home care are really central to that mission. People are directly coming home from a hospital where they've had a knee replacement, a hip replacement, where they might have had cardiac surgery. They're coming directly into home. And that is a movement that is not only helping the patients who want to be at home, but actually helping the taxpayers, because the Medicare program is finding that we are more cost effective. The Medicare Trust Fund is staying more solvent. The more we use home care over other settings, the more we're preserving Medicare for future generations. So not only are we doing great patient care, but we're actually helping to keep the bottom line of Medicare where we want it to be.
And part of that advocacy, of course, is making sure that we get the right amount of reimbursement for that care. We'll get to that in a little bit. But Holly, I think that's what we've been seeing, and I think working together after the merger with Chicopee VNA, and now Porchlight has expanded. That was one of your goals and a strategy to be able to have a small nonprofit to be able to be stronger in this market of healthcare.
Absolutely, and we are treating people who are much sicker at home than they used to be, and people are being discharged from the hospital, you know, the same day after a procedure that kept them in the hospital 3, 4, and even 5 days at a time 10, 15 years ago. And now they're having their surgery and then leaving the hospital the same day and coming home. And our clinicians need to have a higher skill set in the community. And I'm proud to say that our clinicians do. Our therapists, we have a respiratory therapist, physical therapist, occupational therapist, speech therapist, and our registered nurses all have the skill sets that are needed, and they're constantly being educated as to the new procedures that are out there.
And one of the things as far as education, it is the education of the consumers to be able to ask, because I think that's one of the things that has perhaps changed, and hopefully we're getting to a point where patients feel more confidence, families are feeling more confident about making their feelings known and being able to have a two-way conversation in the world of healthcare, Holly, as opposed to perhaps how it has traditionally been.
I got a beautiful letter today from a client of ours who lives in Massachusetts, but her physician and hospital was in Connecticut, and it was about a 3-hour drive for her to go back to the surgeon to be followed up on after her surgery. And she was writing me a letter to tell me how wonderful the nursing care was, and to also let me know that the surgeon was very impressed with the nursing care that was delivered and the level of skill that the nurse had to follow the doctor's orders to keep the patient out of the hospital. And the patient was so impressed that the surgeon was complimenting the nurse that she just wanted to make sure that I had that information.
These are key relationships and education at the level of the consumer, but also, Pat, at the level of our fellow healthcare providers,
Right.
you know, those surgeons,
Yep.
those hospitals, and others, because ultimately there's a lot of influence, you know, no matter how much you're engaged in the conversation as a family, obviously they are going to generally listen to their physician as
Right.
to what the next best step is. So being able to make sure physicians and especially those specialists understand what can be done in the home care setting, that's a process.
It's definitely building a level of trust with physicians and surgeons. And in the past, there were patterns of care. People went directly to a nursing home or rehab because that's the way it was always done. Now we're educating physicians how to, if someone's going in for elective surgery, to screen them before they go in, to say, I think you could go right to home. This is what you can expect. We might even have the home care nurse come in and talk to you before the surgery, if possible, so you'll know what to expect. When you go home, here's what you can expect from home care. And I think sometimes families who don't understand that, the whole family can be the patient of the home care agency, so that if someone's coming home, a spouse with someone who has just had surgery, not only are our nurses in there taking care of the patient at the surgery, but also educating the spouse. This is what to look for. This is when to call us if something happens. This is what, you know, our 24-hour line if something happens. So people need to understand that we have the backup for them. Sometimes people think I'm not able to do it, even though I want my husband or wife home. What can I expect? So having that conversation before the surgery even happens with the physician, with the family, is something agencies like Porchlight VNA do all the time now. So that by the time the patient comes home, everybody knows what to expect. Everybody knows when the nurse is coming, when the therapist is coming, you know, what to do if something happens and we're not quite sure who to call. All that is set up in advance.
And dealing with Porchlight, everything's been so personal for so long. That's one of the great reasons why Porchlight has been, I think, successful, is that special level of customer service, a really community-based organization. And as things are evolving, and Pat, you know these ACOs that are really have been talked about for a very long time, where the hospital is sort of the payer source, and the more efficient the care down the line, the better everyone makes out from a financial perspective, which is ultimately supposed to provide for better outcomes. It's interesting how this is all shaking out, but how do you see this being rolled out? Has it been what you've expected?
In Massachusetts, the healthcare reform is really far ahead of the other states that we've talked with. I know recently I was in Washington, D.C. at a conference, and The other states were kind of amazed at how advanced we are at the development of post-acute networks and how we're, moving forward with them. So I think Pat probably could speak to the ACO model in a great way.
Right. Part of the federal reform was, this movement to say that the Medicare program, which paid for a lot of services for people, was very siloed. The doctors did their thing, the hospitals did their thing, the VNAs did their thing. But now the system is truly driving people to be more accountable to each other and eventually to the patient. So in some ways, the reform towards accountability, both for patient outcomes and costs, is good for VNAs because that's our sweet spot. We have always been patient-centered. We have always been cost-effective. But I think that what we're seeing in Eastern Mass is moving to the West, that suddenly, payment models change and agencies like Hawley's are being asked to prove themselves every day, not only to patients, we have always proven ourselves, but to people who hold the purse strings for Medicare in different ways. But I feel fully confident that good community agencies who deliver good outcomes, and those outcomes are available for the public to see on the Medicare website, I think they will be able to thrive in this new environment if given a chance.
And also those entities that are sort of affiliated with the hospital seemingly would have a sort of advantage in that way, which again, if it's all about the outcome, it should be all about the outcome. So so there have to be, I'm sure there are challenges in doing all this and making sure that it is about the outcome.
It's also about the workforce too. I mean, home care is a really growing, in every part of the state, home care is a growing employer. I mean, we're adding home health aides, we're looking for nurses, we're looking for therapists, in particularly areas like Western part here in the Berkshires, where travel and there's long distances between patients. I think that agencies like Porchlight that are willing, able, and have staff that can go into very rural and remote towns will remain critically valuable. We have to make sure that they stay solvent and able to do their business because it's very difficult. In Eastern Mass, a visiting nurse might be able to see 5 or 6 patients a day. In Western Mass, in some cases, that could be 2 or 3, depending on how far you have to travel. So we have to be sure that agencies like Porchlight are able to be reimbursed or able to serve those towns because we can't lose service in these most remote areas.
Yes, and Porchlight is not considered a rural agency, even though we service rural towns because of the city of Pittsfield and the population there. So that's how, if a city is within a certain distance to your organization, that's how they make that determination. So, it would be good if they could take a look at that and,
We've been working on that.
Right, because we
Only
know
in the government can a rural town not be rural because they're adjacent to a city like Pittsfield. But that's it's interesting. Hamden County is considered rural, but Berkshire County is not by the beauty of government mathematics.
Which is interesting because it would be one thing if we had an interstate running through the north and south corridor of Berkshire County, but that's not the case. It literally does take from one side of Berkshire County to the other, or from Lee, the home base, to say Clarksburg. That's a good hour, at least one way, and 2 hours two ways at the very least. So so yeah, it's part of the advocacy is to understand it's different out here in the Berkshires. It really is.
And it's not just semantics. The Medicare program has recognized that for VNAs like Porchlight who have to travel distances, or in similar situations to Porchlight, they're actually getting rural add-on for their care. But because the Berkshires is not considered rural, Lee doesn't get that extra money from Medicare. So one of the advocacy points we're talking about is talking to Congressman Neal about that because it's not just a designation. It actually translates into dollars per patient.
Right.
And so tell me a little bit about the Home Care Alliance as far as who are the members. Obviously Porchlight is one as a nonprofit that does both the VNA services and the home care, but you have a pretty large umbrella.
We represent about 200 agencies that provide care in the home. About 125 of them look similar to Porchlight in that they do a lot of Medicare business, insurance business, work with seniors who qualify for services. But we also represent agencies like Porchlight Private Care, if I have the name correct, that provide services to families who are struggling to provide care to a loved one who may not qualify for services. We represent about 80 of those agencies. And one of the messages we're often out there talking to families about on behalf of those agencies is that you don't have to go it alone. Maybe care is more affordable, help is more affordable than you think. You don't have to go it alone. Oftentimes we hear people say, well, mom would never have anybody come in but me. I'm the only one who can take care of her. And we really work to talk to the public that agencies are used to that conversation, and oftentimes when they do come in and start taking care of mom, the caregiver is so relieved because we're helping them out, and the mother, grandmother, whoever the patient may be, in a month can't imagine their life without this caregiver. So oftentimes we have to break through those barriers of like, oh, I don't want anybody in my home, or mom doesn't want anyone but me. And oftentimes with the experience that our agencies have, we see that all the time. And a month later, we hear, I couldn't do without.
I think that would be a very typical response, because for me, Holly, it's all about your quality of life and quality of time with mom or dad. And if much of your time is being spent caring for your mom, of course you want to do that, there's no doubt about it, but it's about that quality time. And if you can have support to help your mother or father or whoever it may be, the family member, your loved one, to be able to have their needs taken care of, activities of daily living, that sort of thing, and you can enjoy the good times with them, that makes such a huge difference in quality of life.
It really does, and our caregivers are background checked and reference checked, and I think in some ways home care has gotten some bad publicity around that. But the majority of caregivers, whether they're at Porchlight or some other agency, are very skilled at making people feel comfortable with them in their own home. And they do things the way the patient wants them done. The patient's in charge, it's their home, you're a guest in their home, but the caregivers get to understand and know that this is a difficult thing, and how would they feel if someone came into their house and started to take charge. It's not a comfortable feeling to give up some of that independence and some of that take charge attitude. Everyone wants to be in charge of themselves and their own home, and when they have to give up a little bit of that independence, it's frightening.
It is, and yet, again, when you have that ability to have those things taken care of, and like you said, Pat, on the other side of things, the appreciation, I'm sure, is so great when there's that recognition. So then, as far as that perception of, well, geez, I don't know if we can afford this, how do we sort of deal with that conversation, and then also understanding, I know the Porchlight also has a low income fund, which is also helpful as far as that goes, but how does a family know whether or not that they would be able to afford or qualify for this type of care?
Well, the usual example that I give to people is, if your car breaks down, do you get it fixed? And they say, well, yeah. And I said, well, how much do you pay a mechanic? Oh, they're really expensive. So I'll say, well, how much do you pay them an hour? Oh, I don't know. It's somewhere around $100. I don't know. It's expensive. So I said, okay, but do you question that, or do you just put your car in and get it fixed? And they say, no, I just put my car in, I get it fixed, and I pay the bill. So I said, so then if you need a little bit of extra help at home because your body isn't what it was 50 years ago, then what's the hesitancy, to pay for this a couple of hours a week? And we have a lot of people qualify for a lot of funding that they don't know is available to them. And that's one of the things we do well, is we connect them with those organizations and those funds that are available.
And of course, you work very closely with Elder Services.
Absolutely.
And that is one of those entities. And Pat, each region has their own Elder Services entity that's able to make decisions and then make referrals to the home care agencies, in which you would have some reimbursement for the family to be able to pay for.
And many states don't have programs like that. And again, we're fortunate in Massachusetts that we have the Elder Services funding that can pick up where Medicare, for instance, may leave off. And I do think Holly's right. Sometimes families don't understand that they may qualify for that. They're trying to go it alone. And I totally agree with you, John. We see sacrifices all the time women, and it tends to be women, although men step up too, who might give up a job or be sacrificing time with their children, and they just feel like they're, put in an incredibly difficult place and making incredible sacrifices. And as Holly said, we're there to help them, not supplant them in any way as the primary person taking care of mom or dad or grandmother. And we find that they're making sacrifices. I mean, the numbers, they say, it's hard to verify, that 80% of home care is actually provided by family members, and only 20% by agencies like Porchlight, because families, are, as the population ages, are really out there doing incredible work. And we think some of them could really benefit by just having a Porchlight come in and take a look at what they need, even if it's only a few hours a week, so that mom can get to the soccer game or can get to a PTA meeting or something. I mean, we, as Holly said, all our workers are criminal background checks, have experience, have training. And that's another point I might make, if I may. Sometimes when families get into this situation, they might look to sort of what I call the underground economy. Maybe I can find someone in the community, and that's fine. If you know the person, it might be relative, that's great. But often I think people feel that going that route, which may be more cost effective, works for them. But in the end, I think using an agency is, the peace of mind. You can't put a price on it, and they may find that the difference is not that great in what they're paying.
And the Home Care Alliance does have accreditation for private pay companies, and we are the only private pay entity in Berkshire County that is accredited by the Home Care Alliance. We're very proud of that.
And that is very important. And then on the other side of things, and Holly, we're always having this conversation, that the opportunities for employment in healthcare leave a wonderful a track for people to follow. And Pat, I don't know if you have any statistics at all, but as far as the number of people employed in the home care realm, but also the projections, I'm sure, are also very high for that as far as opportunities.
I don't have the numbers of people employed in home care, but oftentimes in parts of the state, our home care agencies, our VNAs, are among the greatest employers in their communities. And in fact, we sometimes look, even in Boston, sometimes we look at the census, and there are more people getting home care in the city of Boston than are in the Boston teaching hospitals combined. Our reach is so great. And the Department of Labor, the Federal Department of Labor, does project that personal care services are probably one of the fastest growing job employment opportunities for the next 50 years or so, just because of the demographics. More people want to age in place, they want to stay at home, and personal care services is not something you can contract out to India or somewhere else. It's done in the home, it's done here by someone. So it can be a career path for folks too. I mean, we do find that sometimes some of the family caregivers we talk about end up finding that they had a calling for this and end up working in home care and saying, geez, I sort of felt that this was meaningful work. So we can create career paths for folks to come into providing care, and it's very rewarding.
Yeah, and I
it
think
could pay a little better, but we struggle with that's where we do policy work to try to get more money from the government.
Exactly, but also for a young person, getting into home care and perhaps getting their certification as a certified nursing assistant, that can be your first step to then becoming an LPN perhaps, and then an RN, and so on and so forth. And of course, Holly, you're a registered nurse by background, and then found your way in sort of the administration role as a CEO. So there are paths.
There are, and we do have, we are certified CNA school here in the Berkshires, and our next classes are in December. So if people are looking to get into that career path, they can certainly give us a call at 413-243-1212 and sign up for our CNA class, which is held here in the Berkshires.
Wonderful, and that sounds like a great topic for our next program next month as well, to really talk about that and get the word out. And Pat, how can people get in touch with you and learn more about the Home Care Alliance out in Eastern Massachusetts?
Yep, the best way is to go to our website if people have access to a computer, which is www.thinkhomecare.org, and not only is there information on there for families about how to choose a home care, how to have a conversation with a home care agency. There's information there about insurance, what's covered and what's not, So thinkhomecare.org.
Wonderful. And of course, Porchlight's website is porchlighthomecare.org. So Pat Kelleher, Executive Director for Home Care Alliance, thank you so much for joining us today. A great pleasure
Thanks so
meeting
much.
you.
Thanks,
And,
Pat.
Thanks, Holly.
and Holly, of course, always a pleasure to have you on your show, our show, Porchlight. Always a pleasure. So thank you so much.
Thanks for having us, John.
Thank you.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.